Hello, my name is Sebastian Probst. I'm a professor of tissue availability and wound care at the University of Applied Sciences and Arts Western Switzerland and at the University of Geneva. Today we talk about the care of palliative and malignant wounds. According to the World Health Organization, approximately 56.8 million people around the world require palliative care each year, and nearly 26 million of them are in the final year of life. Yet, despite this tremendous need, about only 14% of those who could benefit from palliative care actually receive it. The WHO has urged countries to develop national strategies, invest in resources, and provide training to improve access to palliative services. While that call applies broadly to palliative care, it also applies urgently to an area that is too often overlooked: palliative wound care. This is a form of care where the wound may not heal, but where comfort, symptom relief, and dignity are always possible. Today, I'd like to walk you through how we approach palliative and malignant wounds with empathy, clinical evidence, and respect for each person's goals. In the Smith+Nephew video, we are going to take a look at what palliative wound care is and identifying types of wounds and symptoms we most often see, how to support patients and caregivers through a truly person-centered team-based approach, and we'll apply evidence-based techniques to manage pain, exudate, odor, itching, and bleeding. Let's get started. So, what do we mean when we talk about palliative wound care? Palliative wound care is person and family-centered, holistic, interdisciplinary care of wounds that may heal or not, or may be too onerous to treat. It focuses on comfort, symptom control, and dignity, rather than cure. It is care for individuals who are often vulnerable and have impaired quality of life, and it is not limited to the end of life, but rather to anyone experiences serious health-related suffering due to wounds. So, these wounds, as I already said, are wounds that may not heal, or wounds where aggressive treatment would be more harm than good. So it includes malignant wounds caused by tumor growth, chronic pressure ulcers in frail or immobile patients, vascular and diabetic wounds in people who no longer receive curative care. Malignant wounds, also known as fungating or cancer wounds, occur when cancer invades the skin and surrounding tissues. They are most commonly associated with advanced stage malignancies such as breast, head, and neck or skin cancers. These wounds relate from tumor growth, disrupting blood vessels, lymphatics, and tissue architecture, leading to tissue necrosis, infection, and chronic inflammation. Because the underlying cancer continuously impairs normal healing processes, these wounds typically do not heal unless the malignancy is effectively treated or brought under control. Therefore, managing the cancer is a prerequisite for any meaningful wound healing. Here a tip for clinicians. Ask yourself, will curative treatment improve this person's comfort or well-being? If not, then it's time for a palliative plan. So palliative wounds don't just cause physical problems. They touch every part of a person's life. Patients describe pain, for example, like burning or sharp knives, odor that's embarrassing or repulsive, and frequent dressing changes that feel exhausting, even traumatic. It affects how they eat, sleep, move, and how they see themselves. Palliative wounds affect various patient groups, including cancer patients. That means malignant wounds from breast, head, and neck tumors. Elderly patients. This means those with advanced illnesses like cancer, COPD, or heart failure. Neurological disorder patients, ALS, multiple sclerosis, and stroke patients who develop pressure ulcers. Bedridden patients, that means those in hospice or long-term care, at risk for pressure ulcers. So our role isn't just to manage a wound, it's to support the whole person, and just as importantly, to support their caregivers. Many are family members who are overwhelmed, undertrained, and emotionally drained. We owe it to them to provide guidance, reassurance, and empathy. According to a recent international survey, over 500 clinicians ranked pain, odor, and exudate as the top concerns in palliative wound care. These symptoms significantly impact quality of life for both patients and caregivers. Now let's go into the practical side. We'll look at the key symptoms of palliative wounds and how to manage them effectively. Pain, exudate, odor, itching, bleeding, and nutrition. The first symptom is pain. Pain is the most common and most feared symptom, yet it's still often undertreated. It's important to recognize that palliative wounds involve both nociceptive and neuropathic nerve components. So please don't rely solely on the WHO pain ladder. Make sure to also include medications that address neuropathic pain specifically. So what helps? Regularly assess pain and adjust treatments. Use tools like the verbal rating scale or pain AD for dementia patients. Consider topical morphine gel.
Systemic analgesics like paracetamol or NSAIDs like ibuprofen are a good starting point.
In difficult cases, gabapentinoids such as pregabalin may be effective for neuropathic pain, especially in frail patients, considering polypharmacy. Apply topical agents like EMLA cream for dressing changes.
If dressing changes are the cause of wound pain, consider choosing non-adherent dressings or those with silicone adhesive to minimize trauma on removal.
Don't overlook virtual reality or distraction tools, especially for younger and anxious patients. Ask your patient, what helped you last time? The question goes a long way. The next symptom is exudate. Excess fluids causes maceration, leakage, and discomfort. You have to imagine that a malignant wound, for example, can deliver up to 1 liter of exudate a day. So what can we provide to our patients? Regularly assess peri-wound skin for damage or macerations, and therefore choose dressings that absorb and retain fluid effectively. Use superabsorbent dressings or foam dressings to reduce change frequency. Ostomy bags may be useful for wounds producing a high volumes of exudate. Protect surrounding skin with barrier creams or films. Teach patients and caregivers how to identify early signs of breakdown or infection and when to ask for help. The next symptom is odor. Odor is emotionally devastating. Patients say it makes them feel ashamed or dirty, even though it isn't their fault. So, what can we provide our patients? Cleanse the wound to remove bacteria, exudate, and slough. Apply topical metronidazole as gel or use the solution for cleansing. Use silver or honey-based dressings as appropriate. Use charcoal or cinnamon-based dressings to absorb or contain odor. Try environmental tricks such as a bowl of shaving foam or cat litter placed discreetly that can neutralize odors in a room. Avoid scented sprays or incense that may cause more distress. And most importantly, tell them, this is the bacteria, not you. We can manage it together. The next symptom is itching or pruritus. This may sound minor, but chronic itching can cause real distress. Try to apply menthol lotion, calamine, or cold compresses. Capsaicin cream applied around, not on the wound. Antihistamines or gabapentin if it's a neuropathic in origin. For persistent pruritus, consider mirtazapine, especially if the patient has sleep issues or concurrent depression. and keep adhesives and dressings hypoallergenic whenever possible. The next symptom is bleeding. Palliative wounds are fragile and can bleed easily, even suddenly, especially if you have a malignant fungating wound, when you have the tumor below it. So, what can help? Use non-adherent dressings and change them gently. For active bleeds, apply pressure for 10 minutes using tranexamic acid or adrenaline. For more severe or recurrent bleeding, consider chitosan-based dressings or colloidin-coated gauzes. These materials help form clots and are especially useful in patients with clotting disorders.
Seek emergency care if wound fails to stop bleeding after 30 minutes of direct pressure.
Education. Most importantly, train caregivers. Help them stay calm, take action, and know when to reach out. Education plays a crucial role in enabling patients and caregivers to manage wounds effectively. Teach basic wound care skills, infection prevention techniques, and especially emergency responses training to bleeding and worsening symptoms. In addition to that, nutrition is also vital. Encourage protein intake between 1.25 to 2 grams per kilogram body weight a day. Consider oral nutritional supplements with arginine, glutamine, and zinc. The nutrients are critical for immune function and wound healing. By empowering caregivers, we reduce stress and improve patients' well-being. To summarize, palliative wound care prioritizes symptom management over healing. A holistic patient-centered approaches improve quality of life. Managing pain, odor, and exudate is essential for comfort. Caregivers need support, education, and respite care. A multidisciplinary team approach ensures the best outcomes. Let me end with this. Palliative wound care is not about healing the wound. It's about healing the person's experience for living with one. We may not be able to close the wound, but we can always provide relief, comfort, and dignity. We can support families, we can reduce suffering, and we can help people feel human again, even in their final days. Thank you for your time, your compassion, and your commitment to this important work. This wraps up our Smith+Nephew presentation on palliative and malignant wounds. Today, we looked at what palliative wound care is and identifying types of wounds and symptoms we most often see, how to support patients and caregivers through a truly person-centered, team-based approach, and we'll apply evidence-based techniques to manage pain, exudate, odor, itching, and bleeding. I hope this will guide you in creating better outcomes and a better quality of life for our patients. And make sure and check out our other titles on Smith+Nephew Academy online. I'm Sebastian Probst, and thank you for watching.